When dealing with a measles infection, most people are sick just for a few weeks, then fully recover and obtain a lifelong immunity to the virus. However, a small subset of the population is going to develop a debilitating, if not fatal, swelling of the entire brain, called subacute sclerosing panencephalitis. It occurs in about 1 in 5,000 adults and 1 in 600 children age 11 months and younger. In this video, we're going to be looking at a very unfortunate case of a young woman who developed SSPE 20 years after getting the measles. Her mom graciously shares her experience. Let's see.
I'm Jo Walton and this is Sarah, my daughter. Sarah was born in 1979 and she was a very wanted, healthy, happy baby. Went through all of her normal milestones, usually a little earlier than she should have done. And at the age of 11 months, she contracted measles,
which is a critical time for developing SSPE.
She wasn't particularly poorly and she recovered very rapidly and went on to have a very normal rest of her childhood. Her teenage years were marked by loads of successes. She did really well at GCSE level, she did really well at A level, and then she went off to university. And having finished with the 2-1, she decided that she would pop herself off to King's College to study midwifery. Around about the beginning of 2004, she told me that she wasn't feeling very well. And by the February of 2004, she was actually signed off her course. She was getting quite upset about the fact that she knew she was ill and she didn't know what it was that was wrong with her or what was going to happen. The progression of her illness went in stages. You'd think that she was okay and she was starting to recover a little bit. And then there would be something else would drop off. We eventually got a diagnosis at the beginning of September.
SSPE presents in 4 distinct stages. Stage 1 is very subtle. You might have some anxiety, some depression, headaches, maybe an occasional fever, but nothing very specific. Certainly nothing that you're going to attribute to your measles infection decades earlier. Stage 2, things get a little bit worse. You might become forgetful. You could have vision changes. You might get some spasm of the muscles, even seizures. In stage 3, the muscle spasms become more frequent. You can get overall body rigidity. It can become very difficult to breathe. It can also be fatal. And then we have stage 4, where areas of the brain regulating heart rate, blood pressure, respiration become involved, and death ensues. SSPE, unfortunately, is fatal 95% of the time.
The consultant came out to see us, so we knew that it wasn't good news. And at that point, we were told that she had subacute sclerosing panencephalitis, and that this illness had been caused by the measles virus. The measles infection that she'd had when she was 11 months old, and it had taken over 24 years to actually develop into something far more deadly, far more devastating than the measles virus could ever be.
This is exactly how SSPE starts. You have a measles infection, you fully recover, and you seem fine for years and years, in her case 20 years. SSPE, subacute sclerosing panencephalitis, is an inflammation of the entire brain. Therefore, it's devastating. It occurs decades after you've resolved your measles infection. And the reason is, when you get the measles, the virus inhabits the brain, the GI tract, and the lungs. And it seems that in these individuals, it never really clears from the brain, and instead causes damage very slowly but continuously. Unfortunately, when you develop SSPE, it has a 95% fatality rate.
SSPE is a very rare disorder. It's a very rare complication of the measles virus, but it is devastating. Right back at the beginning, when Sarah was a baby, Sarah had had most of her normal vaccinations, but in terms of the measles vaccine, I'd more or less made the decision that we weren't going to go for it because of the allergy side of things, as it was an egg-based vaccine.
This is extremely unfortunate. You see, even today, people who have egg allergies are concerned about getting the MMR vaccine because during its production, it does use chicken embryo. However, there are no egg proteins in the vaccine itself. Therefore, according to the CDC and FDA, it's perfectly safe to receive an MMR vaccine if you do have an egg allergy. The proteins that would cause the allergy simply aren't in the mix.
But then nobody ever mentioned SSPE to me. That wasn't something that I was able to put into the mix.
What we see here is her mom giving her nourishment through that feeding tube that's going through her nose, down the esophagus, and into the stomach. Being in a chronic vegetative state, any liquid or solid placed in her mouth would most likely end up in the lungs, causing a severe infection, if not a fatal pneumonia.
In terms of the decisions that I was making. And I've got to say that now, knowing what SSPE can do and the devastation that it causes to a life that was full of so much promise, and the devastation that it has wreaked on other lives that were so full of promise. If it was a choice between taking a risk against the possible allergy or allergic reactions to the vaccine, I think I'd go with those. In fact, I know I'd go with those rather than the risk of a child of mine contracting SSPE.
I'm quite appreciative of this mother releasing this video because it's going to help other people make a decision. Unfortunately, she decided not to get the vaccine due to the possibility of the egg allergy. And we have to remember, most people decide not to vaccinate their child because they want to do what's best for them and they're afraid the vaccine might harm them. Could you imagine the internal angst knowing that your decision caused this horrible, life-threatening outcome in your child? So it's really amazing that she put out this candid video. And I think she did a great service for the world. Now, what I'm going to ask is, besides giving me a thumbs up and subscribing, is to show this video to as many people as you can. Any friends that you might have that don't want to get the vaccine for their child or haven't gotten it themselves really should watch this video, because even though it's relatively rare, when this complication occurs, it's devastating. I hope you understand now why I personally am so concerned about this measles epidemic that's going on. Now you know a little bit more. Take care. Have a good day.